Already? I'll call to order the Sparks City Council meeting of April 27th, 2020 with a roll call, please.
Mayor Smith,
Here.
council members Abbott,
Here.
Lawson,
Here.
Anderson,
Here.
Bybee,
Here.
Dare,
Here.
City Attorney Adams,
Here.
City Manager Cruz.
Here.
We have a quorum. Thank you.
You want to read that letter, Lisa?
Absolutely, Mr. Mayor. Good afternoon, and thank you for joining us. Due to the social distancing requirements enacted in response to the COVID-19 pandemic, the Sparks City Council meetings will be hosted in this virtual setting until further notice. The safety of Sparks residents, employees, and elected officials are important to us, and we appreciate your patience as we journey through this virtual meeting together. The City of Sparks uses Zoom, a third-party app, for its virtual meetings and does not control its technical specifications or requirements. Your ability to participate in public comment during this meeting may be impacted by factors like the type of device you use, the strength of your internet or cellular signal, and the company that provides your internet or cellular service. The City of Sparks is not responsible if you are not able to participate in a meeting through Zoom due to these or any other factors. For those watching and listening from home, general public comment will be announced for items 4 and 12.1. If you wish to speak during general public comment, you will need to call in using the phone number provided on the City Council agenda. Public comment will not be permitted on social media outlets. You will be muted upon entry to the virtual waiting room. Our clerk's office staff will admit you to the meeting. If you would like to speak during item 4 or 12.1, press *9 on your telephone when prompted. You will be called on to speak at one at a time by the telephone number you are calling from. Please be listening for the clerk to read off your telephone number. No video callers will be admitted to the meeting. When you are called on to speak for public comment, state your name for the record and begin speaking. The timer will begin when you say your name, and you will have 3 minutes. Any person who disrupts the meeting to the extent that it is disorderly conduct will be removed from the meeting. Thank you again for joining us, and the meeting will now begin. Mr. Mayor?
Okay, thank you. We do not have an invocation speaker today, but we will do the Pledge of Allegiance. Mr. Lawson, would you lead us, please?
Unmute myself. I pledge allegiance to the flag.
To the flag of the United States of America and to the republic for which it stands, one nation,
God,
under
God,
indivisible, liberty and
with liberty and justice for all.
Okay. Okay, do we have any public comment, Lisa?
And I will remind participants at this time that if you would like to speak during the public comment period, to press *9 on your telephone at this time. And I am not showing any, Mr. Mayor.
Okay, I'll bring it back to the council for approval of agenda 5.1. For a motion.
Mr. Mayor, move to approve. Paul Anderson.
Okay, we have a motion. Looking for a second.
Sorry, Ron. Second, Donald Abbott.
Okay, we have a motion, second. Any further discussion? Seeing none, all in favor say aye.
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 Aye. Aye.
Opposed? Passes unanimously. Okay, 6.1, consideration and possible approval of the minutes of the Sparks City Council meeting for April 13th, 2020.
Move to approve.
Okay, we have a motion. Look for a second.
I'll second that motion.
Okay, we have a motion. We have a second. Any further discussion? Seeing none, all in favor, let's try to say aye all at once. All in favor, say aye.
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 Hey, good. Opposed? Passes unanimously. Okay, we'll move on to number 7, announcements, presentations, recognition items, and items of special interest. I don't have the presentations, Lisa. Do you want me to read them from the agenda?
That's fine, Mr. Mayor. The first presentation is regarding the COVID-19 pandemic from the Washoe Health District.
Okay, so that's, we don't have any,
no commendations or proclamations.
We have none. Okay, so we look at a presentation from the Regional Preparation and Response to COVID-19 pandemic event by the Washington County Health District Officer and Incident Commander. Kevin, welcome.
Yes, Mayor Smith, thank you for inviting me today. My hair is getting a little longer every day, so I'm eager to get a haircut sometime in
There
the
you
future. But I want to say how impressed I am with the high tech in your Sparks branding and backdrop on everybody. So you look great. So I'd like to begin with kind of where we're at right now. Today marks the 3 months from when the health district activated our incident command status with our department operation command. That was after we were already a couple of weeks into the COVID outbreak that was occurring, the pandemic that was developing. And at that point were to the point where we needed to get into that ICS structure to be able to manage our staff and move forward with this. So this has been a long response that we've been involved with. And I think we may be nearing the end of the beginning, but we have a lot still in front of us as we move through this. We've ramped up our call center staffing to handle calls coming in from the public, identifying people that are symptomatic and need to be tested, having them scheduled for testing, operating our drive-through posts to collect the samples for testing, working with the state lab to get the tests, providing the results back to individuals, working with the positive cases to do the case contact investigation and identify all of the people that they had been in contact with that should be quarantined because of potential that may have been exposed to the COVID-19, working with those positives to help them understand what they need to do for isolation until they recover, to monitor them through that process until they can be released. And then we're working with contacting all of those individuals that need to be quarantined and helping them understand what it is that they need to do during that quarantine period, monitoring their symptoms, reporting back to the health district, having them tested as necessary, et cetera. So we've got all of that infrastructure operating. And then we've also been operating as part of the JIC and working on the messaging to the community with the social distancing and the staying at home for Nevada, only going out for essential needs, face coverings. I think everybody knows the types of messaging that's been being put out there. So I want to say I really appreciate the regional partnerships and all of the other entities that we're working with through this response, all of you. And I see that we have Sean McKevers on the call as well. I want to express my gratitude for his participation in the health branch. He has been instrumental in our organization and how we've approached this. And so we have very much benefited from his contribution from the city of Sparks in assisting us with our efforts. So I wanted to acknowledge him.
Thanks, Kevin.
We continue to have good capacity at our hospitals, both with acute care and ICU beds, as well as ventilators. Just had some updated numbers from the hospitals as of yesterday that for acute care beds, 58% occupancy with those. For the ICU beds, 49% occupancy. And for ventilators, 23% of ventilators in use. So they've done a good job with the postponement of elective surgeries and working to reduce the population in the hospital. And we've also, I think, done a good job with the social distancing efforts as far as flattening the curve to avoid having that surge that overwhelms our hospital capacity. So as we've progressed through the pandemic here and the outbreak that we've experienced, What we've seen are the models going from a steep climb to a high peak that would overload our healthcare system to a much flatter or a not as steep increase in the number of cases and a flatter curve that it looks like we'll have sufficient healthcare capacity into the future, as long as we continue to effectively manage how we're working to prevent the spread of the disease in the community. So Renown has constructed built out one level of their parking structure with a capacity of 700 beds for additional treatment capacity at the hospital. We had been working with the Army Corps of Engineers and of course our incident management team to develop plans for an alternative care facility. And we have suspended the build out of that facility, which we had planned to put over at the Reno Sparks Convention Center, based on our current assessment that we're not going to need that based on the numbers that we're seeing. We have been looking at, there are a number of different models projecting where we're going to end up with this as we move through it. One that we think is aligned fairly closely with what we're seeing in our actual numbers is the Los Alamos Labs national model. That one we expect to be updated sometime later today. But as of last Thursday, that model was staying fairly consistent with the previous update to it, which is that 80% probability that for the state of Nevada, we had already hit our peak number of new cases reported per day by Thursday, or I'm sorry, Wednesday, the 22nd of April last week. And that the highest probability, if we hadn't already experienced our peak, was that we'd be hitting our peak either this past week or the coming week. So it's likely that we've passed or are at the peak. And we're watching the numbers. What we're seeing is that we kind of have plateaued, and we need to watch to see that we're making continued progress with a reduced number of cases occurring each day. Now, there will be fluctuation in cases reported each day. Just there's this variation as we're testing different people and how many come back positive. We'd had an increase on Saturday, up to 36 new cases that were reported on Saturday. We think that some of that might have been associated with the Easter holiday and people having social gatherings, extended families getting together, et cetera. But fortunately, what we saw the last 2 days are 13 cases reported yesterday and 16 cases reported today. So we're cautiously optimistic of where we're at. We're continuing to watch this into the future. While we have adequate capacity now for our testing, we're also working to ramp up capacity for testing in the future. And just to give you an idea of our capacity currently, we have our post has been set up to be able to collect samples from 300 people per day. We also had an option of adding just one more sample collection point in that setup, and that would bring us to 400 per day over a 4-hour period. The post that we ran today, I believe we collected about 150 samples. That's because we're also seeing, it seems, a reduction in people that are reporting influenza-like illness symptoms. And we don't have people contacting us with symptoms that to be tested. So we're also expanding our messaging to the public that if anybody has symptoms that are consistent with COVID-19, if you have allergies, but your allergies are causing you more trouble this year than they have in the past, or if you haven't had allergies before, but now suddenly you think you've got allergies that you're developing, that might be COVID-19, and you should please get in touch with us so that you can be tested. But we have plans that we've developed to be able to expand our capacity for testing up to 1,000 individuals per day. And and with further ramp up of that we could achieve 5,000 a day, we believe. This is part of our approach for getting through the phase 0 phase of our forward movement that the governor has outlined to ensure that we have consistent or adequate and growing capacity for testing. The test that we're running is the PCR test, which looks at the RNA of the virus to identify if it's the virus is present when the sample is collected. The lab currently has capacity for running about 500 of those tests per day. That's the Nevada State Public Health Lab over at UNR that's done a remarkable job in working to continue to have their capacity for the testing and to be manufacturing and providing us with the test collection kits. But the state DEM is working with FEMA, working to secure additional of the swab test collection kits that we need. They have plans to, or working to procure 28,000 of those per week for use statewide. So their initial goal is to ramp up to 4,000 tests per day that are being done. And the lab is also working to incorporate some other equipment and some slightly different approach to the analysis using a nucleic acid amplification, which will identify the COVID specifically to be able to increase their capacity up to 3,000 or so tests per day is their projection if they're able to demonstrate that that works for approval by the state sometime toward the end of May. So working hard on how to be able to conduct additional testing. We're also developing plans for mobile testing at different facilities, are working with the state on approaches to doing testing in some of their licensed facilities, long-term care facilities, doing more testing of our healthcare workforce, as well as our first responders, our fire and law enforcement personnel. So that's our future path forward with going up after those priority populations for testing. And I can tell you the state medical advisory team, I believe, is working on how do we open up to additional testing more broadly in the population in the future, putting together what the criteria would look like and the strategy for doing that testing. So we're trying to work closely with and coordinate with the state as they develop their plans for moving forward. The Nevada State Public Health Lab is also working on the validation and evaluation of one of the antibody tests that's out there. So this one identifies whether you have been exposed to COVID-19 and whether you've developed antibodies to it. And so they're doing that evaluation right now. I think you've seen in the news, there are numerous tests that have been developed, some of which are seeking FDA approval, others which have just been distributed. So there's a wide variation of the antibody tests and their performance. And so we're looking at this test for use in Nevada, and we're hopeful that that will pan out for us and be an additional approach for testing that will provide, I think, better information than just a point-in-time test, which is what the test is that we're doing now, of whether somebody had COVID-19 or not that day that they showed up to get tested. The antibody test will be able to tell us whether they have already had it at some point in the past. So that's kind of where we're at with our testing. And for the future, we're going to be moving through this, as the governor has told us, in different phases of reopening our economy. So we don't expect that we're going to just reopen everything at once, but looking at what are some of the businesses that we can reopen that have less risk associated with them as far as further disease transmission. What are the operating parameters that they would use while they're reopening and in business into the future to try to prevent that spread of disease from occurring? And coupled with the testing and monitoring of what number of cases are occurring and are we having additional surge happening in our communities. We need to be very careful as we move forward that we don't go back and basically have made all of the sacrifices to date for naught, because we're now going into a whole new surge that could take us back up to levels that could exceed our healthcare capacity. So we need to be managing this as we move forward to make sure that our strategies for the reopening are effective and we're not seeing a dramatic increase in numbers of cases that are occurring. So we'll expect that we'll have several different phases of that reopening coming into the future. The testing that we'll be conducting will be coupled with a very strong contact tracing element, so that as we identify positives, they can be appropriately isolated and we can appropriately quarantine people who they've had exposure to limit spread of disease from cases as we identify them moving forward. So to that end, currently we have the National Guard that are deployed with us, and they are assisting with taking over some of the responsibilities within our post for the sample collection, but also integrating with our staff for the call center and the contact tracing activities. And so that's a great workforce. We're delighted that they were able to come and help us. We don't expect them to be around for the duration of what we're going to need with testing and contact tracing moving forward. Basically, until we have a vaccine available, we're going to need to be aggressive in our testing and in that contact tracing work to prevent the spread of the disease. We're being told that could be a year and a half out, could be 4 years out. I'm hoping it's much sooner versus later, but we will need to have a staffing into the future beyond when the Guard is deployed. So we're also exploring what our staffing options and approaches are for that. We have plans of the staff that are needed and how to build that out. We also expect to receive money from the latest bill coming out of DC that's providing $25 billion nationally for testing and for the contact tracing. Of that, $11 billion is identified for distribution to state and local public health agencies. So fortunately, it looks like we're going to have some federal financial support for the investment that we're going to need to make to maintain that moving forward. So I think that's my summary. I know Sam Hicks, our incident commander, has got some additional information for you. I'd let you decide whether you want to hear from him first or if there are questions for me.
I have a question. As far as the amount of testing, what's the minimum amount of testing we have to do to get out of phase 0?
So I don't know that there's a minimum number that's been established by the governor. The number I do know is the initial target is for those 4,000 tests today.
Statewide?
Statewide. And if you look at our population as roughly 15% of the state population, that would be 600 tests for roughly for Washoe County per day.
Okay, questions?
I have a question.
Okay, Ms. Spivey.
Kevin, on the tests that you're going to be performing and the new ones coming in, do those include some of the rapid tests, the Abbott and the saliva tests, to be able to do them faster and greater numbers? Is that in the new testing you're looking at acquiring?
Yeah, thank you for that question, Councilwoman Spivey. I neglected to talk about the Abbott tests. We do have Abbott rapid tests that we've received. So there's two different Abbott tests. There's the antibody test that the lab is evaluating, but there's another Abbott test that's the RNA amplification test. So it's very similar to the PCR test as far as the specificity and reliability of the results for identifying COVID-19. And the rapid test runs on a toaster size unit that runs the test in about 15 minutes. So it's a good point of care test to be able to get rapid results on. So we had 4 of those test units that were provided through FEMA to the state or the health district. And there's one also that Reno Sparks Indian Colony received. So there's 5 in the community. We received just a very limited number of test cartridges, though, that go with those. So each of those units, we started with just 8 test cartridges. So each cartridge is 1 test of 1 person. We have a resupply system that's been set up where we're supposed to receive, basically we'll receive a weekly quantity of those cartridges for each of the units to be able to run 60 tests per week. So it's very great to have a test that can run so quickly. We're limited right now with what we expect to have for the supply of the cartridges that are required for running the tests. We're hopeful that number will increase as we move forward, and then we can have more units available so that we can build toward the type of capacity we have in our healthcare system and have become used to for the rapid flu test and other rapid tests where they're in doctors' offices and you can go and get tested and get results quickly.
Thank you.
Yeah, I have a question, some of it's just for clarification, because we get to hear some of this stuff and we understand when we talk about surge, but part of it is we have a lot of our constituents asking us a lot of questions about that. What does that look like? Why are we building? I know we said we paused some of it because we don't see the big curve. We just say a surge happened. What do you actually? We just make it really clear for anybody else listening because they don't get to be in all of our daily meetings that we hear about and stuff. Can you just explain why it was necessary, just so as people are processing what we're doing, they can see that our region, our leaders are looking at the best for the health and care for them?
Certainly, Councilman Dare. So we had a kind of a 3-dimension strategy for how we were working to prepare for the COVID outbreak here in Washoe County. One of the strategies was to build up the capacity within our hospital system to be able to treat larger numbers of people based on the initial models we had of what was expected with the growth that was occurring in the number of cases, which we saw was going to exceed our hospital capacity. Now, in order to have the capacity that you need for a surge that's projected to come in the future, you need to start building that capacity right now, immediately, or you're not going to have it when you do need it. You don't want to start working on that when you're in crisis and you're exceeding the capacity of the hospitals. So that was why the effort was made with the build out of the Renown space and the plans that were occurring for the event center. The other dimension is that with the potential of a surge exceeding the capacity of the hospital systems, the other piece of the strategy was the governor activated crisis standards of care under the emergency. And crisis standards of care is the approach, a very difficult approach, but one that's ethically driven by how we would allocate medical resources when the number of people needing treatment and access to those resources exceeds the availability of those resources. So there was work that was done on how that would be handled in our community, what the criteria would be around that decision making if we surged to the point where we exceeded our capacity and didn't have those medical resources. The third part of the strategy was the social distancing, the mitigation measures, the flattening of the curve. And so we were working on all three of those together. The first two, so that we're prepared based on where we see things are going. And the third, to try to change where we're going so that we don't actually have to have that situation where we're exceeding our capacity. And so that was the social distancing measures, the governor's directives for closing of non-essential businesses, the stay at home for Nevada, now the recommendations for the facial coverings. That messaging started very early on with the hygiene and sanitation, and increased as we saw the growth in additional cases. So fortunately, with that strategy, we think that we've been able to reduce the curve so that we're not in a situation like people have seen in the news with New York City and New Jersey, and just the human tragedy that's happening in those communities with their healthcare system being overwhelmed.
Kevin, thank you. And I thank you for explaining that really clear. We get a lot of different questions, but I just want to say that your team, I know, is working over hours all the time, probably not even really turning off their mind as much as possible. And it's just probably hard. So thank you, and I appreciate you.
Thank you.
Any other questions or comments?
I have some questions, Mr. Mayor, if it's okay.
Who is that?
Chet Adams, City Attorney.
Sure, Chet, go ahead.
Can you tell us what the COVID-19 recovery rate is?
I can. I don't have a recovery rate here in front of me, but it's we've had 278 people that we've reported recovered so far. So if you can hang on just a minute, I got a calculator here.
All right.
So that's a 34% recovery rate right now.
And how did this COVID-19 compare with the flu this last season? Hospitalizations due to the flu.
I'm afraid I don't have those numbers in front of me, and quite frankly, our numbers for the flu are quite incomplete because we, through our flu surveillance, are using Sentinel healthcare providers that report data to us. And we typically, through the flu season, are compiling that information on a weekly basis, as well as what's being reported from the hospitals. And so from some point in February on, we haven't even had the capacity for maintaining our flu reporting numbers.
And you mentioned an antibody test. Wouldn't an antibody test really help us to understand just how prevalent this disease really is? In other words, it gives you mentioned flattening the curve, but wouldn't this really give us a true denominator on this disease or this virus?
Would you like a job at the health district? It's a good analysis. The antibody test is going to be very important for us, and we're very hopeful that we have something that we know is specific and we can use effectively, because it will tell us how many people in our community have been exposed to the virus to the extent that they've been able to develop the antibodies for it. So that will help us understand much better what the rate of infection has been, because as I mentioned, the other tests that look at the RNA are just a point in time test. And so if somebody's already had COVID-19 and recovered from it and don't have that viral load anymore, they would show negative if we brought them in for a test after they've recovered, and we wouldn't know that they had already had COVID-19. The other piece with the antibody test that's important will be if we are able to determine that people that have had COVID-19 and have the antibodies develop immunity over some period of time for the disease, then that will also provide us with information about people who should be safer to be able to have without the social distancing restriction on them if they are indeed immune for the disease for some period.
I know, because one of our other council members mentioned something about a surge. And if we find out that the vast majority of our population, in fact, has this antibody, then whatever surge that we do have would be put into a proper perspective, correct?
Yeah, I think the other piece with the surge that the antibody information is important for us is the rate of spread of the COVID-19 disease will be also dependent on the number of people that have immunity to the disease. And so as we have more people that are testing positive with the antibody tests, that tells us what degree of people that may have immunity are, with the theory being the more people that have been exposed and recovered, who are then not susceptible to the disease, that helps to provide the herd immunity that we need in our community. So if 25%, I don't think our number is that high, but if we had 25% of our population that has immunity, then 1 out of 4 people that the disease might be transmitted to through those contacts is somebody that can't get it. And so as we increase that number, if we get 50% or more that have been exposed and are immune, now you're starting to narrow the odds on who's available for this virus to infect.
Sure. The greater the herd immunity, the less likelihood of the spread of the virus.
Correct.
And one more thing, you mentioned contact tracing. Could you explain to the city council what that is?
So the contact tracing is an interview that is conducted with the positive cases, in which we try to ascertain where they were, where they went, who they saw over a period of time that goes back several days before they develop symptoms of the disease, because we know that you can have viral load in the early days before symptoms develop. And so identifying all of those, what we call case contacts of the positive case. The positive case needs to then also be informed of the need to isolate until they recover from the disease. So the contact investigator will work with them on their isolation plan, where they're going to do it, if they're doing it in their house, how they're going to work to protect other people, the monitoring of their condition through their illness, and them working with us to determine when they've recovered and can be released from the isolation. We also then contact each of those contacts that we identify, which range from 5 to 20 people per case, some even more depending how social they've been. And we contact each of those individuals and work with them on their requirements for quarantine and their quarantine plan of where they're going to stay for 14 days as they move through the incubation period, the monitoring that they're going to do to see if they develop any symptoms. We're in contact with them and they report to us on their condition through that period. We have them tested if necessary as symptoms develop. And we also, these are people, both positives and the people that are being quarantined, that have a lot of questions for us as well about the disease, about what they need to do. They may have needs for assistance through this period. So we're also, these contact tracing people are also a little bit of element of a case manager, social worker type thing as well in working with these cases through that period. So there's quite a lot of work involved in that whole process.
Don't you think, though, that before the government tells somebody that they have to self-quarantine, that they're entitled to an antibody test, at least to see whether or not they are at risk?
Well, I think once we have an antibody test available, it would be great to be able to do that. But we're not at that point yet.
Thank you, Mr. Mayor, and thank you, sir. I appreciate all your time and your expertise.
Thank you.
Okay, any more questions or comments? Okay, where did he go? Oh, there you are, Kevin. Did you bring someone else along with you?
I thought we had Sam Hicks dialing in as well,
We
our
do.
incident commander.
You want to give Sam some time?
I thought he had the Zoom contact for this, so I don't know where he is.
Sam is here,
This
so
is
go ahead and
Sam.
start, Sam.
Good afternoon. This is Sam Hicks. Kevin covered most everything. The only thing he probably didn't cover, I think, was the Edison housing project that is fully stood up, available, and it's designed to allow an alternative place for people to go that needs to be quarantined where they can't isolate or quarantine voluntarily in their home as of right now. And there's 300 rooms available down there at this time. We talked a little bit about the ACS alternative care site. We initially, when the modeling was initially going on, it looked like we were going to be overrun for hospital capacity. So we had solicited the Army Corps of Engineers to come in and help us build a non-acute with a small section of acute beds in the convention center, Reno Sparks Convention Center. And thankfully, with the social distancing that's been going on and the models changed, we did not have to stand that up. However, should we need to, it could be stood back up in about a 10-day build time. And there's trigger points established with the hospitals as to when we would, if we needed to, stand that back up and get it built out, ready for capacity. Other than that, we're, just plugging along, trying to coordinate and help where we can.
Sam, you're only using half of those trailers over there. The other ones are still on Gregg Street.
Correct. I don't even think we're using half of them. We have 60 trailers, and it seems to me, it's been quite a while ago, but I think they had 1,300 rooms available. So, we have a small fraction of their trailers, and I believe they also have a laydown yard out on USA Parkway, someplace where they have more of them staged as well.
Okay. All right. Questions for Sam?
Do we have anyone staying?
Go ahead.
Go ahead, Donald. Donald, go ahead.
Do we have? Do we have anyone staying at Edison right now, or is it vacant? Or
we don't currently have anybody in any of the units at this time. And I guess I should mention there's flow charts through the Housing Human Services division that you have to meet certain criteria to be there. You can't just go in there because you want to go in there. They have a very nice, well thought out flow chart to be able to go in there that meets the COVID-19 requirements for that housing plan.
how would someone see that flow chart, or who they talk to, or they think they might be?
Kevin, would the health district be able to get that to Sparks? I'm sorry, I don't know who the gentleman is talking.
Donald Abbott, Councilman Abbott, sorry.
Councilman, okay. Councilman, I can see if I can get you that flow chart. It's pretty extensive, but I don't have any problems trying to get it to you.
I guess I was just saying, if anyone from the public thought that might be a fit for them, how they would go about that process of getting signed up or applying or whatnot.
So they have to be screened, and they have to be either basically COVID or COVID related to get in there. And they call the housing, go through the screening branch. And I'm sorry, I don't have that number in front of me. There's a number they call, and they will run through the criteria to get them in there. A lot of this is generated out of the hospitals, where somebody can be discharged from the hospital that doesn't need medical care, but they need a place to go where they can't isolate without contaminating somebody. So the hospitals have that flow sheet and the numbers to call, and they would run through that check sheet, and it's basically a placement for that facility.
That makes sense. Thank you.
Jack, did you want to say something?
No, Councilman Abbott, this is Chet Adams, Spark City Attorney. Councilman Abbott, were you talking about the Edison House project?
Yes, sir.
Okay, yeah. So my understanding that the vacancy rate there is pretty high.
You were correct, sir.
That's for you, Sam.
Yes, sir. There's nobody in there at this time.
Okay, thank you.
Hey, Mr. Mayor, I do have a question for him. When they're
Go ahead,
giving
Paul.
us the numbers in the 50% of hospital beds that are taken, does that include the overflow out in the renowned parking garage?
Sam, did you hear
Kevin,
that?
are you still on?
Yeah, I think I was muted there for a minute. Those capacities do not include the parking garage. So we're in very good shape with the build out that was done on that as far as our capacity moving forward. I think that as we move forward, there'll be discussions with the hospitals and the governor's office about being able to resume elective surgeries, those types of things, if we're staying at these levels moving forward.
So there's a possibility we may never need those trailers out at Edison Way.
Well, this one of the things that we might think about is the scenario that we may have in the future if we're reopening the hospitality industry and we have guests from out of the area that develop symptoms here that require their testing, and perhaps if they're positive, require their isolation. Perhaps they expose other people in that hospitality setting. They're from other areas that would need a place to either isolate or quarantine. So I think we need to be thinking about some of those scenarios as well moving forward.
Okay. Any other questions or comments? Okay, Sam and Kevin, thank you so much for the presentation. Thanks for coming in today.
Thank you for having us.
Thank you very much.
Thank you.
Okay, we'll move on to the presentation about Proctor Hug High School at Wild Creek. And who's
Thank you.
doing that?
It's me, Mr. Mayor, Jim Rundle.
Okay, Jim.
Thank you, Mr. Mayor, City Council, Jim Rundle, Planning Manager. Today, we're going to hear from Washoe County School District and their Chief Facilities Manager Officer, Adam Siri. In April of last year, if you can believe it's almost, or actually I think it was May, but it's almost been a year, the City of Sparks approved a development agreement to lay out the process and commitments of Washoe County school districts to mitigate the impacts of construction of a high school at the Wild Creek Golf Course. The development agreement, amongst other things related to construction, included a commitment for infrastructure upgrades to that area to mitigate the impacts for that facility. The development agreement required Washoe County Schools to come back to the City of Sparks, City Council and Mayor for an update, a check-in, if you will, for an opportunity to demonstrate the compliance to the development agreement and to communicate with the Mayor and City Council the progress on the construction of the high school. In fulfillment with that requirement, Adam is here today to provide a presentation, and I will now turn the dais over to Adam.
Adam, welcome.
Yes, thank you. Pleasure to be here. Again, Adam Searcy, Chief Facilities Management Officer for the school district. As Jim described, I'm here to give an update. It's a rather brief presentation on the project, but also a big part of today is open question and communication with the City of Sparks if desired. So I'm going to go ahead and share my screen and run through the presentation. Give me just a moment here. Hopefully everybody can see the presentation now.
I think so.
Okay. So just a little bit of background. Most of you were involved in this for multiple years now, but just for the good of the order, really this was a project envisioned in the 2016 ballot initiative, WC1. We really kicked things off in 2017 with a series of meetings with multiple agencies, clear through into 2019, as Mr. Rundle described, in 2019 with the development agreement between the school district and the city of Sparks. So in between the latter half of 2019, the school district's been finalizing all of the project designs, but then also submitting and going through various final approvals and permitting processes. This image here was taken in March 2020. It shows the completed ore ditch in the foreground here, but really shows the remaining portion of the public golf course, and then of course the city and the Truckee Meadows further on. So again, throughout the remainder or the second half of 2019, a lot of permitting activity was initiated and completed between primarily the school district and the city of Sparks. A lot of the requirements of the development agreement were double and triple checked throughout that permitting process, ensuring that all of our proposed plans included measures to address elements that were agreed upon in that development agreement. And this slide here really is to highlight the power line transmission relocation that many of you were part of a conversation. You can see up here far above where the future school site will be, the power line was relocated during December, January, February months up out of the way of the building. So really during these months, we relocated the power line and the ore ditch from the future school campus, kind of bringing us forward to where we are today. The primary construction of the project is intended to be delivered over the course of 4 separate construction contracts, just for ease of logistics and contracting. Clark Sullivan Construction will be our general contractor for the entirety of the scope. But here is just a rough breakdown or a high-level breakdown of how we anticipate delivering this project. The ore ditch, you can see, is a separate, almost like a utility relocation portion of the scope. I'll get into a little more detail here in a moment, but basically that work's been completed to date. The on-site work also is underway as we speak. And we'll talk about that in a moment. And then the building we'll see kicking off here mid-2020, really starting into construction, the off-site work, more of a 2021 phase, all leading up to an August 2022 completion and opening of the school. So just a little bit more detail on these 4 major construction or contract elements of the project. The ore ditch relocation, I've described it as a utility relocation, right? The existing ore ditch traversed through the school district property and really was ultimately decided would be best for everyone involved if we just moved it out of the way of the future school. So this is quite the utility relocation. You can see there's 3 pipes actually creating what's called an inverted siphon. So the water flows downhill and then is pushed back up to an elevation lower than where it goes into the pipe. So this was quite the project, but fortunately we had excellent contractors helping us and Mother Nature helping us a bit through the winter. This work has been completed to date to the satisfaction of everyone involved, really just holding out for the ditch itself to be turned on and flowing water through here, likely within the next few weeks. This, I should note, it was a complicated approval process to a certain degree. Getting the ore ditch on board with the situation, of course, directly impacting the city of Sparks. So ensuring that the city of Sparks was comfortable with everything associated with this construction project. And then also noting that the relocated portion of the ore ditch that you see in these pictures is actually located on Washoe County property now. So we have an agreement with Washoe County. Actually, it's between the ore ditch company and Washoe County to maintain these improvements in perpetuity into the future. So pleased to have that largely in our rearview mirror. We'll be looking forward to seeing water flow through that soon. Next up, and as we speak out there, we have the earthwork and utilities on-site earthwork and utilities contract. These images were taken from late March, really shortly after they began the work out there. If any of you have driven past it recently, you'll know that they've been making tremendous progress really on a daily basis out there. Again, it includes hundreds of thousands of yards of mass grading, but also all of the on-site utility work. So you're going to see this contract stretch well into 2021 with some of that work, but very visually impactful. It's been very visually impactful to the community as well. So we're sensitive to that, working hard to communicate with the neighbors and be respectful with all the work and the noise and the dust that can create. But still, nevertheless, very exciting milestones for our projects. Moving into the future just a little bit, we have this rendering image of what the school building is anticipated to look like. We've been working closely with the City of Sparks and many other agencies to get these improvements fully permitted and approved for construction. We're very, very near completion of that. We anticipate being able to execute this construction contract likely at the end of May with our school board. And we anticipate that, major construction will begin certainly summer 2020, and you'll really start to see that visual impact of the building going vertical construction later this summer. So the fourth and final phase that I wanted to highlight with you all today, we'll just loosely call the offsite improvements. A lot of requirements within the development agreement associated with the offsite improvements, really looking to make sure our school is mitigating the impacts from a traffic standpoint that it may have, as well as making access to and from the school as safe as possible in a variety of ways. So these are just a couple of snapshots that I included on the screen to illustrate. Here on the left, you've got two roundabout accesses to the campus on Sullivan Lane. And then as Sullivan Lane connects into El Rancho here, we've got another roundabout. So hopefully moving that traffic in a very safe but efficient manner. And then on the right-hand exhibit, you see really this exhibit was created to illustrate the extensive new sidewalk that the school district will be causing to construct in conjunction with this project, really connecting those safe routes between our community and the school. There's also some improvements to the signalized intersection here at McCarran and Sullivan that will all have to be approved through NDOT, et cetera. But this work is likely to begin in the summer of 2021, again, in anticipation of a 2022 completion date. So finally, I just wanted to talk a little bit about the 12-month look ahead. This development agreement is scheduled to a required report to the City of Sparks on an annual basis. So anticipate, if things go well, we're having this conversation again a year from now. In that time, you're really going to see the building start to come out of the ground. Lots and lots of activity on site, of course, but when you start to see that 3-story steel building structure going vertical and coming out of the ground, it is going to be very visually impactful and exciting. Again, very important to the school district that we maintain a close relationship with the City of Sparks, with the entire community, with the adjacent neighborhood. We do our best with a public website and email list, but as always, if there are any questions or concerns, always want to receive those questions and address them. And really want to kind of in part close with expression of appreciation to the City of Sparks staff, going all the way back before the development agreement. Worked very hard to iron out the details of that, ultimately approved by Sparks Council, of course. And then throughout this COVID-19 crisis, tremendous partnership from everyone, almost everyone on this call, as well as a number of other people on the staff to keep this progress moving. It's been an important project for this community and of course the school district, and a great partnership continuing with the city of Sparks. So again, we're on track at this point, very committed to continuing this work safely and with the highest degree of quality in anticipation of an August 2022 completion. So that's really the high level update that I have, and would welcome any questions or discussion that you might have at this time. Thank you.
Thank you, Adam. Any questions or comments? Oh, you're good to go, Adam. Thank you so much.
Okay, thank you.
Thank you.
Give the screen back here.
All right. Okay, we'll move on to 7.3 and 7.4, boards and commission vacancy announcements. Neil.
Good afternoon, Mayor Smith and members of the City Council. We have a total of 5 vacancies that I'm announcing this afternoon. All 5 are for 3-year terms commencing this July 1st and running through June 30th, 2023. The first 2 are on our Civil Service Commission. To be on the Civil Service Commission, you have to be a resident of the City of Sparks. We will accept applications for both of those positions through Friday, May 1st at 5 p.m. Same thing for the other 3, and those are on our Parks and Recreation Commission. And you can either be a city resident or you can have a valid business license at the time you apply. And again, those are all 3-year positions. And for the Parks and Rec Commission as well, we're going to accept applications through this Friday at 5 p.m. If you are interested in serving on a committee, you should complete the community service application available online through our website at www.cityofsparks.us/getinvolved. Once you're there, click on volunteering for a Sparks board, commission, or committee, and fill it out and hit send.
Okay, that's it. Okay, we'll move on to consent items, 8.1. Does anybody want to pull 8.1? Okay, looking for a motion.
Move to approve 8.1.
Okay, so I got a motion from Donald Abbott and a second from Mr. Dare.
Sounds good.
Okay, we have a motion and a second. Any further discussion? Seeing none, all in favor say aye.
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 Opposed? Passes unanimously. We'll move on to general business, 9.1. Consideration, discussion, and possible approval of joint appointment with the City of Reno of 1 elected official to represent the owners of the Truckee Meadows Water Reclamation Facility on the Board of Trustees of the Western Regional Water Commission. Neil, is this the one that that Reno gets it for 2 years and it comes back to us for 2 years?
Yes, it is.
Yeah. Okay. Okay, John,
Yes.
you doing this?
Good afternoon, Mr. Mayor. You just took away half of my presentation. I am John Martini, your Assistant City Manager today, and also in my capacity as the Chairman of the Joint Coordinating Committee of the Truckee Meadows Water Reclamation Facility. Mr. Mayor, members of the council, as you'll recall, one of the board of directors of the Western Regional Water Commission is to represent Tumwharf. Tumwharf is jointly owned by the cities of Reno and Sparks. The 2 cities have mutually agreed to share this elected official position to represent Tumwharf. It is for a 2-year term. The last elected official is Councilman Abbott, but his term expired on the 31st of March of this year. The Joint Coordinating Committee back in March 11th, recommended Councilwoman Bonnie Weber from the City of Reno to represent Tumwharf. The City of Reno did approve that appointment on April 8th, and now it's before us, and staff is recommending your approval.
Okay, any questions or comments? Okay, looking for a motion.
Mr. Mayor, I'll make the motion.
Go ahead, Paul.
Move to approve the joint appointment of Reno City Council Member Bonnie Weber to represent the owners of Truckee Meadows Water Reclamation Facility on the Board of Trustees of the Western Regional Water Commission for a 2-year term ending March 31st, 2022.
Okay, we have a motion. Looking for a second.
I'll second it, Abbott.
Okay, we have a motion and a second. Is there any further discussion? Okay, seeing none, all in favor say aye.
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 Opposed? Passes unanimously.
Thank you, Mr. Mayor.
9.2, consideration, discussion, possible adoption of resolution R 3360 adopting the 2020 Washoe County Regional Multi-Hazard Mitigation Plan. Is that Sean going to do this?
Good afternoon, Mr. Mayor, council members, and city manager. Sean McEvers, Division Chief of Training and Admin with Sparks Fire Department, and the emergency manager. Before you today is item 9.2 for your consideration, discussion and possible adoption of resolution 3360, adopting the 2020 Washoe County Regional Multi-Hazard Mitigation Plan. FEMA requires that each jurisdiction adopt the multi-hazard mitigation plan on a 5-year cycle. Just for a little brief history, in 2010, Washoe County worked closely with the cities of Reno and Sparks, the Reno Sparks Indian Colony, the Pyramid Lake Paiute Tribe, to produce the region's first regional hazard mitigation plan, published in 2010. Then in 2015, the regional partners worked closely again to prepare the 5-year update of that plan. Then in 2019, the regional partners, with the addition of Truckee Meadows Fire Protection District and the North Lake Tahoe Fire Protection District, worked together to complete the 2020 hazard mitigation plan. The plan was produced with experts from various public safety disciplines, including Sparks Fire, police, public works, community development, emergency management, and safety. Specifically for Sparks, I would like to take the opportunity to thank Mark Miranda for his efforts and hard work on this plan. Also, private businesses and citizens also contributed to the plan. The plan was presented to citizens in 7 public meetings and has been approved by the state of Nevada and FEMA. Hence, the final step in the process is formal adoption of the plan by each of the regional partners. In front of you is the resolution to adopt the 2020 Washoe County Regional Multi-Hazard Mitigation Plan. I'm available to answer any questions you may have.
Questions or comments? Seeing none, looking for a motion?
I'll make a motion.
Go ahead, Charlie.
Okay.
Councilwoman Bybee, I move to adopt resolution R3360, adopting the 2020 Washoe County Regional Hazard Mitigation Plan.
And I'll second that, sir.
Okay, so we have a motion and a second. Any further discussion? Seeing none, all in favor say aye.
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 Opposed? Passes unanimously. Thank you, Sean.
Thank you.
Okay, 9.3, consideration, discussion, and possible approval to complete an application for a Nevada JAG grant to purchase a VirTra training simulator. Chief Crawl.
Thank you, Mr. Mayor. Good afternoon. Mayor Smith, members of council, Pete Crawl, your police chief. I'm here before you today to seek consideration, discussion, and potential approval of a Nevada JAG grant to purchase a VirTra training simulator. This training simulator is currently the only simulator on the market that would that meets several different requirements that we are now expected to meet on an annual basis. What it is essentially is a use of force and decision-making simulator that allows us to create an intense and immersive training environment. It is the only simulator on the market that is capable of this, and the simulator does meet the National Post or Peace Officer Standards and Trainings Directors Organization requirements as specifically addressing fair and impartial policing, implicit bias-based policing, de-escalation, and deconfliction. All of those topics are things that we are now required to train in annually under Nevada revised statute. And this simulator takes us beyond the step of simply a classroom environment to something that we can use virtually on a daily basis if we so choose. With that, I'm happy to answer any questions, and staff respectfully recommends approval to apply for the grant.
Questions or comments?
Chief, I do have a question, or actually a couple questions. So are we the only ones in this region that are going to have this type of program?
That is my understanding, yes, sir.
Okay, and do we plan on sharing it with any of the other law enforcement agencies? Do you know?
We would definitely do that.
Okay. And then the last question with, it's looking like budgets are going to be tightening up here immediately. What do we foresee? Do we have to have like a annual subscription for maintenance or anything like that on this program?
No, sir. There's no annual maintenance that we are aware of. This, in comparison with other simulators that have been produced and been owned around the area, this provides a much more extensive library of scenarios and potential reaction and judgment assessors. We don't believe that there would be any future, there's no annual maintenance or things of that nature attached.
All right, thank you. Yeah, it sounds like it's critical for the training of all of your officers. So thank you.
I think the National Guard contacted you, I believe. They thought we had the simulator already and they wanted to use it.
It's funny in that meeting that I had, sir, that specific thing didn't come up, but we have been in contact with those folks.
Yeah, okay, good. Any other questions or comments? Okay, looking for a motion, please.
I got it, Ron, if I can.
Okay, we got a motion from Mr. Abbott. Second?
Do you want me to read it or?
Yeah, go ahead and read it.
Okay. I move to direct the police department to apply for an NVJAG grant in the amount of approximately $84,000 for the purpose of purchasing a VirTra firearms training simulator.
Okay, now we have the true motion. Do we have a second?
I'll second that.
Okay, Paul Anderson seconds the motion. Any further discussion? Seeing none, all in favor say aye.
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 Opposed? Passes unanimously. Chief, I think that's going to be quite an addition to our tools. Very nice.
We're looking very forward to it.
Yeah, good deal. Okay, 9.4, Amber. Consideration, discussion, and possible approval of the contract AC 5662 for the 2020 Community Development Block Grant Street Improvements. That's all I'm reading.
You did great. Mayor, members of council, Amber Sosa, Transportation Manager. So this item is a construction contract for the 2020 CDBG Street Improvement Project. That CDBG, as the mayor said, stands for Community Development Block Grant. This project has two sources of funding. One is the aforementioned grant. This is a federally funded grant that the city of Sparks receives through the U.S. Department of Housing and Urban Development. This project is included in our 5-year annual action plan with them. The second source of funding for this will be proposed from our redevelopment agency, Area 1. I'm going to share my screen. Can you guys see that?
Yep.
Awesome. So this map shows where we're intending to go with the project for this year. Towards the center of the map, you'll see Prater Way, and the streets that we're going to be working on are just south of Prater. It's 16th Street and D Street between Rock and 15th. You'll also notice a section of 15th Street where we'll be doing concrete improvements such as curb and gutter and sidewalk. Now, the concrete and the roadway infrastructure in this area was originally constructed in the 1950s. Today, the surface of the road has severe structural failures and surface deterioration. The sidewalks are experiencing exposed aggregates, missing chunks, and tripping hazards for our pedestrians. Areas of the curb and gutter are impeding normal roadway drainage. All of these issues will be rehabilitated within the areas of this project.
Will that be done during the summer? This summer?
Yes, sir. It should be,
Okay.
yes. This project was bid by the city of Sparks in March of 2020, and we received 5 bidders. The construction contract before you is with the low bidder, Sierra Nevada Construction, in the amount of $496,007, of which $257,007 will be covered by the grant, and a proposed $239,000 from RDA number 1 fund. With that, I'm happy to answer any questions you may have.
Okay, questions or comments for Amber? Seeing none, looking for a motion. Ms. Bybee.
Oh, okay, I can go ahead and move. I move to approve contract AC 5662 for the 2020 CDBG CDBG Street Improvements Federally Funded Project, bid number 19/20-020, PWPWA 2020-146 to Sierra Nevada Construction in the amount of $496,007, comprised of $257,007 from the City of Sparks and $239,000 from the Redevelopment Agency of the City of Sparks Redevelopment Area 1 funds.
Okay, we have a motion. Looking for a second.
I'll second it. Abbott.
Okay, got a second from Mr. Abbott. Any further discussion? Seeing none, all in favor say aye.
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 Opposed? Passes unanimously. Thank you. Thanks, Amber. Okay, 9.5, Jeff Kronk. Consideration, discussion, and possible approval of fiscal year 2020 through 2021 budget recommendations and fiscal items, including the city manager's recommendation to the City of Sparks final budget, the proposed 5-year capital improvement plan. You're up. Where'd you go? There you are.
Right here. Thank you, Mr. Mayor, members of council.
Your sound is pretty weak.
Is it? Let's try this. A little bit better?
A little bit, not much.
I don't know what to do about that. It was working.
You're sounding a little bit better. We can hear you.
A little better?
Yeah.
Huh. That's interesting. I'm actually at City Hall today, so I should be plugged in pretty good. So interrupt me or wave at me if I disappear. But good afternoon, Mayor, members of the council. So this is our annual presentation to you. And actually, before I kick it off, I wanted to see if our city manager had any initial comments he wanted to make. Otherwise, I will dive right into it.
Thanks, Jeff. I just got a couple. The first is to acknowledge that it's labeled as the city manager's recommendations for fiscal year 2021. And I yet have grown comfortable with it being labeled as my recommendation, because simply put, it is not. There are hundreds of staff members across the city that worked on that that very long booklet that we emailed to you about 10 days ago. So this is a whole lot more than just my recommendation. Yes, it is, per the charter, I'm the one who's supposed to bring the budget forward for your consideration, and that's what we're doing here today. That's what the process calls for. But this is a whole lot of effort from a whole lot of people to get us to this point. So I just wanted to start with acknowledging that there are people in every department across the city at every one of our facilities that contributed information into allowing us to prepare this set of documents we're asking you to go through this afternoon. And I thank each and every one of them for their efforts. This is the culmination, or the near culmination. Not quite. We've got another month before we're asking you for final approval. But we're very near the end of more than a 6-month process to get this $230 million worth of budget approvals and numbers and capital projects in front of you for your consideration. And I'm very proud of our staff and the work that they have done to get us here today. With that, I'll turn it back to Jeff.
Thanks, Neil. Jeff Kronk again here for the record. So this is going to be a little bit odd from the standpoint of we're presenting to you recommendations going forward to file the fiscal 21 year budget. And I'm going to say it straight up front that, we think this is going to be wrong. In fact, I know it's going to be wrong. No matter what we file this year, it's going to be wrong. So because of all the craziness that we've been encountering the last month or so. So what we're presenting in front of you today is really the culmination, as Neil had mentioned, of a good 6 months of a lot of hard work from a lot of different people, but that started way back in October in earnest when we really started diving into this and engaging a lot of the departments and trying to gather information as far as what the expected expenditures were needed going into the next fiscal year. And then as we started that process, also diving into what kind of revenues we expected, and then marrying those two up. So that sort of culminated in our workshop that we held in February 24th, I believe, if I got my date right, a budget workshop. And so what I'm presenting to you today, honestly, is not that different than what we covered at that workshop. If you recall, most of that information was at least on the revenue side, was based on December and January's financial data, economic data that we're able to pull together, and expectations for our revenues. And quite frankly, even then, I mean, I think the COVID-19 was just starting to kind of rear its ugly head. But even then, we had expectations going forward of a certain reality. And that's the reality that we're putting forward to you today as our proposed budget. So it's high. The revenues are going to be high than what we think it's going to happen. The problem is we just don't have sufficient data to provide adequate projections and to make realistic expectations as to what our budget expenditures should be, into this new reality that we're finding ourselves. So, what we decided was to propose to you filing a budget that essentially is status quo, if you will, from what we presented in February to you. Certainly still a policy-driven budget, and we took your recommendations and your direction at that time and built and fulfilled those 6 policies that we covered, and we built that into these recommendations that you see before you today. I just want to cover those very briefly, so I'm not going to spend a lot of time on it because, again, we already did. We already spent several hours, and again, it's not substantially different than what we had before. But the first policy is to establish a minimum ending fund balance. The second, and we landed on 5%, if you recall. You don't want us to go into lower than 5%. Well, the reality of that is that that's built into this fiscal 21 budget recommendations. But the reality is that we'll probably get there in a very different way, right, than what we thought before. But we still, from a policy perspective, are establishing that very key policy metric to establish, what our financial stability is. It's probably the number one that we have. The second policy is to establish a contingency budget. That has not changed. No change there since February. The third policy is transferring resources from the general fund to the capital projects fund. And we covered that this morning in the capital improvement plan for the 5 years. So that matches. The fourth policy is to commit some business license revenue to the stabilization fund. We're still going to do that as we talked about in February. This is going to be a little bit different in that probably sometime in July or August at the latest, we'll probably bring a agenda item to you to drain that fund. So, but for accounting purposes, there are some accounting rules that I won't get into, but from a technical side, that really require us to go ahead and put money in there in the fiscal year, even though we're probably going to take it right back out. So, and that's if you remember, to stabilize, to either mitigate costs related to natural disaster or stabilize the operations in a revenue decline. And actually both those are consistent. But we'll bring that agenda item to you at a later date. But from a policy perspective, we still want to utilize that fund. So we're going to ask you to approve putting money in there, and then we're going to pull it right back out here in a couple of months. The fifth policy is that our personnel costs are less than 78%. That's still going to be the case. How that mix is going to look as we go into next fiscal year, we don't know yet because we don't know what the revenues are going to be. So, but that's still our goal. And so no recommended change on that. And then finally, the sixth policy is just really reporting out what our liability, personnel liability benefit benefit liabilities are, and then how we're going to pay for those. And we spent a lot of time, if you remember, on workers' comp. Again, this fiscal crisis isn't going to change that. If anything, it's going to exacerbate that financial problem. So we're still going to have to address that. But from a policy perspective, we're still going to recommend a pay-as-you-go process. So at the end of the day, what we're asking for your approval today is not the final approval of the budget, but your approval to build the final budget. So this isn't the last bite at the apple, so to speak. We've got one more coming. So what we're doing today is asking if this is the right direction that you want to go. We will then take that direction. Staff will then build the final budget, and we'll bring that back to you the last week of May. And if you recall, just for some housekeeping, items, that last week of May, we also have to have a public hearing on the tentative budget. The tentative budget has been filed as required by law, has to be filed by April 15th. So we already have filed that. And we filed that or built that tentative budget again based on the input that you received or that we received from you in that February workshop. So again, there's not going to be a very significant difference from the tentative budget to the final budget this year. Although that being said, the reality is fiscal 21 will look very different. So what we're doing, again, just to kind of reiterate, is providing a status quo budget really for your consideration, really for 3 reasons. One, again, just we have insufficient data. We really don't know what our revenues are going to be. If you find someone who says they know, don't believe them, because everybody's guessing. So we can make educated guesses, and we've certainly done that. But at the end of the day, when we're talking about building a budget, that means we're locked in from an authorization standpoint. So if we were to artificially drop it too low, for example, then we don't have authorization. We'd have to come back to you. And there are some limitations within Nevada law that would preclude us from doing that in order to get the spending authorization that we would need. So this gives us, so the first reason that for a status quo budget is insufficient data. Second reason is to maximize budget flexibility, and just building on the previous thought, in that this is going to be something that we're going to need to manage too. So we're not really sure if, where we're going to need to reduce our expenses. We know they need to be reduced. We're not exactly sure where at this point, whether those need to be long-term reductions or short-term reductions. We have a lot of tools in our toolbox, so to speak, to get us through the next few months. And we talked about that before. A lot of times those are one-time items though, and really designed to manage our cash flow. But then we need time to figure out and get some data and understand how long this is going to be. So first we need to know how deep, then we need to know how long this is going to last. So the third reason really is we want to establish a baseline for future planning purposes. So this is going to give us, this budget would give us a documentable, filed, authorized budget that we can go back to and say, well, this is what we looked like, or what we wanted to look like had we received an $81 million, roughly in rough numbers there. $81 million in our general fund, if that's how it came to fruition, that's what these recommendations are designed to do. We know it's not going to be $81 million. It's going to be something less. Is it 75? Is it 70? We just don't know at this point. So at this point, for those 3 purposes, we're recommending achieving the most flexibility that we possibly can in getting this fiscal 21 just through this. So then we're going to use this as a stepping stone, if you will, to be better suited to plan as we're looking forward to 22, 23, 24, and so forth. So, so with that, I wanted to leave most of our time open to any questions. I didn't want to give a lot of presentation. What we attached to the agenda item today is a book. We call it the City Manager's Recommendations book, and there's a lot of detail in here, a lot more detail than we go into other funds than we covered primarily at the workshop. But quite frankly, this is used, or this is meant to be used as a reference tool. And this is our budget in our city from a fiscal perspective, sort of in a 260-page document. So, so with that, I wanted to spend most of our time just answering any questions should you have them. But with the overall just reiteration, knowing that fiscal 21, the budget as we're presenting it, should you approve it today, the recommendation, should you approve it today, that we'll go and build that, that we know it's going to be too high. We're not going to be spending all those dollars, but this gives us the tools to manage this crisis as it plays out. So with that, I will be happy to answer any questions.
Questions or comments?
Yeah, I do.
Okay, you, Charlene, and then Ed next.
Okay. So Jeff, do you anticipate as we look into this for the next 6 months, 8 months, throughout this next year till we do next year's budget, do you anticipate as we move through each month and we see where we are as far as lost revenue, as far as cost of this COVID crisis to us, will you be coming back to us through the year? Do you anticipate with specific items that maybe we have in this budget that we can't do, that we have to delay, that we have to adjust as we move forward and have a better idea of those numbers? Is that something that will be happening throughout the year, or not until next budget season?
Yeah. Thank you, Councilwoman Bybee. Yeah, that's my intention. As it plays out, there's certain things that we're going to have to bring to your attention for your specific approval, like the stabilization fund. By law, we have to have council approval in order to drain that. It's not something we can do. That's just an example. But from a educational or informational perspective, absolutely. Our plan is that we're going to know more. Hopefully, the end of summer, beginning of fall, kind of that time period. We're going to have a much better picture as to what our revenue picture is going to look like. And just as a reminder, the biggest hit that we're expecting right now is from sales taxes. I'd be surprised if it was anything else. It's going to be sales taxes that's going to hit us. We don't get the first data point until the end of May, the last week of May. So to your point, as those months roll out, so we'll get May, in May, we'll get March's data. So there's always a 60-day lag, okay? And then in June, we'll get April's data. So it's going to take some time, to kind of figure out when this is going to hit us. So my recommendation from how to manage this, the initial crux, if you will, is we need to manage cash flow. So what we're going to bring before you first and foremost are items that are generated or designed to bolster our cash flow and our reserves and get us through this initial crush until we get an idea of really what the extent is and how long this might take.
Mr. Lawson.
So Jeff, have you talked to the other finance managers around, and are they following the same strategy?
I think yes and no is the short answer. Yes, we right. So yes, we are in conversation kind of all the time. And yes, we're all of the same mind that nobody really knows what to expect from the as far as the revenue goes. The problem with this is that there is no template. This has never happened before, so it's kind of unfortunate. Everybody's looking for answers, me included, and there just aren't any at this point. So to that point, we're trying to not do this in a vacuum. So we have conversations, quite often with my peer group, and how they're approaching the budget. Some are work in process, but my understanding is that yes, most of them have at least communicated to me that they're approaching it from a status quo perspective, with relatively minor, developments or changes to their budget, or things that maybe they do know, whether it's being maybe the costs that are involved, or some other revenue sources that may be smaller that they can put their hands around. But for the most part, everybody's approaching this from the standpoint of moving forward with a status quo budget and then coming back to their various boards late summer, early fall, again, when we know things. But my understanding, it's similar across the board.
All right, thank you.
Any other questions, Mr. Dare?
Yes. Could we possibly, this might go to Neil, but I think it could be wise to have, as we approach things, you've talked to us a little bit, but maybe even letting the rest of Sparks know as we walk forward, kind of, we're in this vacuum, this kind of interesting place where we know what the budget is going to hit, but what the priorities are. Just make it really clear that we're not just cutting back, but things that they can expect out of us. Where are we going to focus on? Where, police and fire, the safety things. We know that because we're in conversations, but I do know fear is an interesting thing as we walk into what's coming. And the best thing we can do is communicate and kind of ease some of those fears. So I think it could be wise to put out just a little bit of, these are our focuses. I think some of these things we say all the time anyway, but it's a good reminder to really come in and say, even if we have to pull back the budget, these are the areas that we are going to do everything we can to keep in place. Does that make sense for you?
It makes perfect sense, and it's actually part of the plan. As we're going through at the staff level right now and refreshing our list of core services and ranking them relative to each other. As we complete that, we will come to you in a public forum, show you our work, and ask you for your input and your adoption at some level as to what those priorities are. And with that information in hand, then we will absolutely turn to the community and say, this is kind of the priority list. this is the priority list for services inside the city of Sparks. And to the extent that we need to make cuts, we will try and spare those that are near the top of the list at the expense of those that are closer to the bottom of the list. And we will just try and lay it out as it is, as you, as our policymaking body, dictate to us the relative importance of those services one against another.
Thank you. That would be great.
Okay, any other questions or comments? Mr. Andrews?
Mr. Mayor?
Yep.
So first I want to say, Jeff, thank you, your team, and all of the department managers, as well as the staff throughout the city. You guys have done a phenomenal job working on this for months now, just for all of this to come crashing down on you. And already you're looking at plans A, B, and C, probably even beyond that, hopefully. But one thing I kind of backing up what Councilman Dare said, I've had businesses here locally as well as homeowners come to me saying, you guys can't raise taxes because we're hurting just like everyone else. And I just want to make sure that we're communicating, that we're looking at different strategies, that we're not just planning on going to the water trough and asking more from everyone in the community.
Sure. The short answer is that we're not raising taxes. In fact, if it's based on a usage, whether it's like a gaming license or a business license or something to that effect, that's based on actual activity, if you will, that'll go down. So whether it's a rate or the property taxes or sales taxes, we're not raising those, nor are we looking to raise those. We just know we're going to be hurting just like a lot of folks. So when that revenue hits, coming down, it'll be hard and fast. So I don't know if that answers your question, specifically, but at the end of the day, we're not raising taxes in this.
Yeah, and thank you. I did understand that, but I just want to make sure that in our messaging that we're getting that across too, because that's the fear that we're hearing already.
Okay. Any other questions, comments? Looking for a motion.
So, Mr. Mayor, may I,
Yeah.
real quick? So we have two motions that we're seeking today. One being the actual approval of the CIP that you had heard in the workshop. So, and on this same agenda item, we're looking for a second motion, approval of the recommendations as presented or otherwise directed.
Okay, so the first motion is a motion you want to approve the budget?
The capital improvement plan, if you would. Thank you.
Okay, the CIP.
Ron, I can make that motion if you'd like.
Okay, Mr. Dare.
I move to approve the proposed 5-year capital improvements plan for fiscal year 2020, 2021 through fiscal year 2024 to 2025.
I'll second that.
Okay, we have a motion and a second. Any further discussion? Seeing none, all in favor say aye.
Aye.
Opposed? That passes unanimously. Okay, now the second motion, Jeff, is to
approval of the city manager's recommendations as presented, or if you had alternate direction. From that, we'll build the budget and bring it back to you in late May.
Okay, looking for a motion.
I'll make
I can do that
motion.
one.
Mr. Abbott?
Paul's got it.
Okay, Paul.
All right, I move to approve the city manager's final budget recommendation for fiscal year 2021.
And looking for a second.
I'll second it, Abbott.
Okay, we have a motion and a second. Is there any further discussion? Seeing none, all in favor say aye.
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 Opposed? Passes unanimously. Thanks, Jeff. Great job.
Thank you.
You too, Neil. Okay, we don't have any public hearing and action items. 10 or 11, I'll open up the public comment. Anybody in the public wishing to speak? Lisa, is there anybody there?
Public comment is now open. If you are on the line and would like to address the city council in the public comment, please press *9 on your telephone now. And Mr. Mayor, I'm seeing none.
Okay, we'll bring it back to the council. Comments from the mayor, city council, city manager. Any comments?
I miss you all.
What's that?
I miss you all.
Okay. Thanks for putting up with the mistakes and everything on this, and good format and good seeing everybody. And without objection, we are adjourned. Thank you.
And
Thank you.
Lisa?
we will be moving right into redevelopment.
Okay. I'd like to call to order the Sparks Redevelopment Agency meeting of Monday, April 27th, 2020 with a roll call.
Chairperson Bybee,
Here.
agency members Dare,
Here.
Lawson,
Here.
Anderson,
Here.
Smith,
Here.
Abbott,
Here.
Chief Legal Officer Adams,
Here.
Chief Administrative Officer Cruz.
Here.
We have a quorum. Thank you.
Thank you, Madam Clerk. Before we move on to the next item, I have an announcement to make for this redevelopment meeting. First of all, we'd like to thank those of you who are joining us that maybe weren't in the last meeting, or if you were there, welcome back to Redevelopment Agency. Due to the social distancing requirements enacted in response to the COVID-19 pandemic, the Sparks Redevelopment Agency meetings will be hosted in this virtual setting at least until April 30th, 2020. The safety of Sparks residents, employees, and elected officials are important to us, and we appreciate your patience as we journey through this virtual meeting together. The City of Sparks uses Zoom, a third-party app, for its virtual meetings and does not control its technical specifications or requirements. Your ability to participate in public comment during this meeting may be impacted by factors like the type of device you use, the strength of your internet or cellular signal, and the company that provides your internet or cellular service. The City of Sparks is not responsible if you are not able to participate in a meeting through Zoom due to any of these or other factors. On our general public comment, for those of you watching today and listening from home, general public comment will be announced for items 3 and 7.1. If you wish to speak during general public comment, you will need to call in using the phone number provided on the Sparks Redevelopment Agency agenda. Public comment will not be permitted on social media outlets. You will be muted upon entry to the virtual meeting waiting room. Our clerk's office staff will admit you to the meeting. If you'd like to speak during items 4 or 7.1, press *9 when prompted. You will be called on to speak one at a time by the telephone number you're calling from. Please be listening to the clerk for her to read off your telephone number. No video callers will be admitted to the meeting. When you're called to speak for public comment, state your name for the record and begin speaking. The timer will begin when you say your name, and you will have 3 minutes. Any person who disrupts the meeting to the extent that it is disorderly conduct will be removed from the meeting. Thank you for joining us. The meeting will begin. And just as a note to anyone else, what I have found is I'm having trouble with my Wi-Fi signal. I think because everybody in the world is on Wi-Fi. So I've had better connections using data. So if any of you called into these or in other meetings, you might try keeping it on data instead of Wi-Fi. Anyway, moving on. We're on item 3, public comment. Madam Clerk, do we have any public comment?
If anybody was wishing to speak at this time, please press *9 on your telephone and request to speak. We'll give them just 1 second, Chairperson Bybee. And I'm not showing any.
Thank you, Madam Clerk. We'll move on to item 4.1, agenda approval of the agenda. Do I have a motion to approve the agenda as presented?
Move to approve.
That was who?
Dare.
Okay, agency member Dare moved to approve. Do I have a second?
Second.
Second, agency member Smith. Any discussion? All those in favor say aye.
Aye.
Aye. Any opposed? Motion passes unanimously. Item 5.1, minutes. Consideration, discussion, and possible approval of the minutes of the Sparks Redevelopment Agency meeting of March 23rd, 2020. Do I have any corrections or additions to the minutes, or a motion to approve?
Anderson, move to approve.
Thank you. Agency Member Anderson, motion to approve. Do I have a second?
Second, Abbott.
Agency Member Abbott, second. All those in favor?
Aye.
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 Any opposed? Okay, motion passes unanimously. Item 6.1, business items. Consideration and possible acceptance of the report of the claims and bills approved for payment and appropriation transfers for the period of March 11th, 2020 through April 14th, 2020. Do I have a motion to approve or any discussion?
Move to approve.
Motion to approve by Agency Member Smith. Do I have a second?
Second.
Second by,
There.
okay, thank you. Sorry, you guys are on the second page, so I'm not seeing you. Second by Agency Member Dare. Any discussion? Okay, all those in favor say aye.
Aye.
Aye. Opposed? Motion carries unanimously. 6.2, consideration, discussion, and approval of the contract ACSRA 320 for the 2020 Community Development Block Fund Grant, CDBG Street Improvements, federally funded project bid 119-20-020 PWPWA 2020-146 to Sierra Nevada Construction in the amount of $496,007, comprised of $257,007 from the city of Sparks and $239,000 from the redevelopment agency of the city of Sparks redevelopment area funds. Do I have Assistant Manager Martini?
Madam Chairwoman, this is Amber Sosa, Transportation Manager. Madam Chairwoman, agency members, this is the companion item to the one that I presented for you guys for the City Council meeting, the construction contract for the 2020 CDBG Street Improvement Project. I'm happy to reiterate any information or answer any additional questions you may have.
Okay, thank you, Amber. Appreciate that. Do I have any questions or comments? Other than that, I'm looking for a motion.
Move to approve.
Agency Member Smith, motion to approve item 6.2. Do I have a second?
Second. There.
I have a second from Agency Member Dare. All those in favor?
Aye.
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 Opposed? Motion passes unanimously. 6.3, consideration, discussion, and possible approval to transfer $1,111,580 from the redevelopment agency number 2 revolving fund to the City of Sparks General Fund to reimburse advancement of funds received from the city's general fund during fiscal years 2012 and 2013 and 2013 and 2014. Okay, and who's presenting this? Is this Neil?
No, Jeff Kronk, the Chief
Yes,
Financial
Jeff.
Officer.
Oh, okay.
Good afternoon, Chairwoman Bybee and members of the agency. This is an item that has its roots really dating back to 2007, really before that, but it was formalized in 2007 as a part of the Disposition Development and Financing Agreement, or the DDFA, with Red Development for the development of the Legends at Sparks Marina. This redevelopment area 2, agency area 2, is the primary area for the Legends, as you well know. As part of that development, the city was required to issue 2 bonds that were ultimately paid off in 2017. But at the time, they were issued by the city, but paid for by the redevelopment agency area 2, which again encompasses the Legends area. As you remember, that's about when the recession really started hitting. And shortly thereafter, in the subsequent years, the redevelopment agency area 2 had insufficient resources to pay that debt service. So again, it was city issued. So the city subsidized and essentially advanced funds to the redevelopment area 2 in order to pay that debt service. We did that in fiscal years 2013 to to the amount of $250,000, and then again in 2014 in the amount of $861,580 for a total of $1,111,580. So it took several years, several fiscal years for the redevelopment area to financially to get back, get its footing and become fiscally healthy again. At the time that these subsidies happened, there really was insufficient money. In fact, there was a doubt as to how long that would it would take, or whether it ever would come back to the point where the redevelopment agency could make those debt service payments again. But in subsequent years, with the help of some land sales and significant improvement in property taxes, we now feel that the agency is on solid enough fiscal footing, so to speak, to pay this money back. So, with that, I would answer any questions, but essentially what we're proposing to do is to authorize the transfer back of these resources from the redevelopment agency area 2 revolving fund to the city's general fund, from whence the original subsidies came back in in those 2 fiscal years that I mentioned.
Okay, so Jeff, let me ask you, have we been looking at this for the last year or two? Obviously, right now we know that we're in a position that this could obviously help out the general fund, but is it something, as you were forecasting, when redevelopment agency 2 would be able to repay this? Did you kind of have a timeline in mind of what when you hope that would happen?
No, and that was the struggle, because as we were coming out of the recession, that improvement happened very slowly at first. So it really wasn't until 2007, or I should say fiscal year 2017, that the agency's property tax receipts really started to improve. And then subsequent to when that debt service, like I said, had matured in 2017, removed the pressure from making those debt service payments, we were able to build that fund balance back. So starting, just really even just a few fiscal years ago, it's something that's always been in the back of our mind. But honestly, this just only been a couple of years that we've been able to honestly ask the question: is this something that's possible? But now, and the timing is good, obviously, just because of the financial crisis, which should not hit the redevelopment agency nearly to the extent, not even close to the extent that it will the general fund. This would be a good time to do that. So with this transfer, we're still, as we'll present here on an accompanying item when we're presenting the budget recommendations, Area 2 should have an ending an ending fund balance of about $5 million this year in unrestricted fund balance this year, and around 7.9 million, and that's after the transfer. So we feel that the finances have significantly improved and should be a good time to do so.
Okay, and does it help too that the redevelopment district 2 does not have any CIP or projects coming up? So the funds that are in there for right now, we've got security there for future projects as we move in the next year.
And it also helps from a planning perspective, because now we can kind of remove this off of that table, if you will, and now we know we're moving forward, with a clean slate.
Okay. Does other questions or comments? Okay, seeing none, I'm looking for a motion.
I'll make a motion for you.
Thank you.
Move to approve transferring $1,111,580 from the redevelopment agency area number 2 revolving fund to City of Sparks general fund as a repayment of the advancements received from the city's general fund during fiscal years 13 and 14.
Okay, I have a motion by agency member Anderson. Do I have a second?
I'll second it, Abbott.
Okay, and a second from agency member Abbott. Any questions or comments? Seeing none, all those in favor say aye.
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 Opposed? Motion passes unanimously.
Madam Chairwoman.
City
before you-
Manager, did you have a comment, Mr.
Yes,
Kurtz?
ma'am. Thank you very much. I wanted to thank the Redevelopment Agency Board for making this step. This is a significant step forward in helping us prepare as an organization for the revenue downfalls. This is I'll characterize it as a bold, decisive step, and we appreciate that you entertained the suggestion and that you acted upon it. Thank you very much.
It's nice we're in that position. See, there's some good news. It's not all bad news. Okay, let's go to 6.4. Consideration, discussion, and possible approval of the Chief Administrator Officer's final budget recommendations for the City of Sparks Redevelopment Agency Areas 1 and 2 for fiscal year 2020-2021.
Good afternoon, Chairwoman Bybee, members of the agency. Jeff Kronk, your Chief Financial Officer. Again, this is the companion item to what we talked about in the City Council meeting. Same process from the standpoint where we're presenting to you the city managers, what we call the city manager's budget recommendations for the fiscal year 21 budget. Knowing again that this is the same process from the standpoint that this isn't the final approval of the budget. This is approval of those recommendations. And again, we will bring those back to you on the same date, the last agency meeting in May. So again, on that same day, we're going to have to go through the process of having a public hearing on the tentative budget. So no different from what the city has to do. So we're going to do those back to back. So again, in area 1, you heard the CIP plan presented to you earlier this morning, and that included a $1 million expenditure for the straightening of the Avenue of the Oaks. And there weren't any plans for area 2. And those were, and then other than the $1.1 million transfer that you had just approved, those were the significant items that are listed in here. Otherwise, there is no no changes from what we had talked about at or what we had expected at the time during the budget workshop time period. And again, the redevelopment agency, as I reiterated before, is not expected to have the kinds of fiscal crisis impacts that we're expecting to see at the general fund, primarily because both areas are funded through property taxes, and property taxes should have a minimal be minimally impacted by this particular crisis, at least for fiscal 21. We'll have to see how that goes forward in future fiscal years. But for that, I would be happy to answer any questions.
Okay, thank you, Jeff. Do I have questions or comments? Hearing none, do I have a motion to approve?
I'll move to approve.
Okay.
I can read it. I move to approve the Chief Administrative Officer's final budget recommendations of the City of Sparks Redevelopment Agencies Areas 1 and 2 for fiscal year 2020-2021.
Okay, so I have a motion by agency member Dare. Do I have a second?
Second, Lawson.
I have a second by agency member Lawson. Any discussion? All those in favor, say aye.
Aye.
Aye. Opposed? Motion carries unanimously. Thank you.
Thank you.
Okay, so we will move on to item 7.1, comments from the public. Madam Clerk, do we have any comments from the public?
The public comment period is now open. If you would like to speak during public comment, please press *9 on your telephone at this time to indicate your desire to speak. And I'm showing none, Chairperson Bybee.
Okay, thank you, Madam Clerk. Let's move on to item 7.2, comments from the agency and Chief Administrative Officer. Any comments from anyone? Mr. Kurtz? Anyone on the agency? Okay, hearing none, we are adjourned. Thank you all.
Thank you.
Thank you.
Thanks, bye.
Thank you.